Hi everyone, thanks for joining this YouTube channel. This is the Child Protection Party's YouTube channel, and we invite you to share, to subscribe, to ring the bell for further notifications and to like. It's very important to us, so please do so right this minute, because this is the Child Protection Party and we're about looking after, caring for and making sure that kids are safe. Children's lives are important, and we at the Child Protection Party want the best outcome for all children. Today I'm going to talk to you about a news item that has come to my attention in relation to Indigenous kids in particular, and but some of the issues that are created in this article concern most parents who come in contact with the child protection system. And it's important that we understand the perplexities, the complexities of this particular issue and how to confront them and what to do about them. So I encourage you to subscribe to this channel, to ring the bell for further notifications, and make sure that you keep up to date on all the nuances and the solutions to a problem which confronts hundreds of thousands of people around this country and around the world. So thanks for being with us. So the article is this one, which is entitled "Birth alerts are meant to help children at risk of abuse. They are routinely used against Aboriginal mothers." And I just need to comment that this is not just about Aboriginal mothers, even though I'm very aware of the number of Aboriginal children that are removed, three times more than the normal population. It is horrible. It is horrific. It is heinous as to what happens to Aboriginal families in the child protection system. And we at the Child Protection Party are very much aware of this problem and how it affects the First Nations people. So the article goes on to say medical professionals are required to report at-risk children to child protection services, but to some agencies, just being black is at risk. And I need to say that it's not just about being black. It's also about being poor. It's about being in low socio-economic areas. It's about being uneducated. It is about a whole host of reasons, which usually focuses on vulnerable people. So people with disabilities, people with learning disabilities, physical disabilities, people that live in poor areas. These are the focus of the child protection system, and this is what affects them, and particularly it happens amongst Indigenous people. So at the end of 2024, Rachel was days away from giving birth. Her feet were dangerously swollen and she was sleeping rough outside an Aboriginal support service in the city. Her reluctance to seek antenatal care meant the usual routine of scurrying between midwives and doctor's appointments for ultrasounds, blood tests and screenings was absent. So we need to understand the context and her situation. Her reluctance to seek antenatal care meant the usual routine of scurrying between housewives' appointments, ultrasound, blood tests, so on. Was absolutely right. Okay, I mentioned that. Pregnant with her second child, she was terrified to seek help from a hospital, fearing her unborn baby would be taken away from her. Her first son was removed at just 11 months old. So one can understand the apprehension this woman would have about this child, given her previous experiences. She said, "I knew I was pregnant with my second boys," she says, "but I didn't want to go to the hospital and have them tell DCP, Department of Child Protection. I had the same feelings of fear I had with my big boy." A ward of the state herself, another factor, which often means that the department will get involved. And on that very point, I can't tell you how often I can remember reading in documentation from the department that one of the risk factors was that the mother was a previous ward of the state. That the fact that they removed her from her family, which wasn't her fault, made it her fault that she was now under the investigation of the department. Absolutely bizarre, but that's what happens. So she was a ward of the state. The overrepresentation of Indigenous children in out-of-home care, a system the former federal senator Pat Dodson likened to genocide, and correctly so. This overrepresentation begins before children are born, with prenatal birth alerts triggered during hospital health assessments if there are concerns for the well-being of an unborn child. And some of the concerns about the child is about the sense that I've just mentioned, in this case being ex-foster kid, also because she's had another child removed. Who knows what she might have improved in the meantime? Who knows the contents of who knows the current situation? And who has been involved with this person to help her through the issues that have plagued her? When Rachel eventually presented at a Northern Perth hospital, she was diagnosed with preeclampsia, a serious pregnancy complication, and told she would be induced for the following week. After being transferred to King Edward Memorial Hospital, Child Protection Department was notified without her consent. So she wasn't even told, wasn't even informed that the department was going to be involved. Rachel had been flagged under Western Australian Health's Child at Risk Alert policy, drafted to reflect the statutory responsibility of healthcare workers as mandatory reporters of suspected child abuse. Though designed to ensure child safety, the policy could have wide-ranging consequences for families involved. Rachel says she struggled to cope after her first son was removed. Understandably, imagine what it would be like. I started using more drugs because they took my baby off me. She says they could have helped me. This is true. They could have helped her. After giving birth to a second son, she was discharged, but a newborn who was experiencing breathing and feeding difficulties remained in hospital. They wouldn't let me stay with my baby, she says. They couldn't accommodate me. I don't know why. Well, because firstly, you're Indigenous. Secondly, because you've been labelled as a lousy, shitty mother. Those social workers arranged a phone and referrals to shelter and rehab services, navigating multiple appointments across the city without transport or a stable home was overwhelming for the new mother. I tried to go back every 3 or 4 hours to feed my baby, she says, but if I missed a feed, they said I was neglecting him. Hospital staff told her the baby wasn't getting enough milk. Every time I breastfed, they came with bottles. So Alicia, a mother of 3 and a former domestic violence support worker in New South Wales, recalls being told by child protection staff that being Aboriginal, just being Indigenous, was a risk factor. The agency I worked with classified being Aboriginal as a risk of harm. How horrible is that? In a statement, the New South Wales Department of Communities and Justice denied that Indigenous identification was part of risk assessment, saying staff worked to ensure children were safe. How many times have we heard that? Thousands and thousands of times I've heard that. Elisa says she saw the bias against First Nations mothers firsthand when she gave birth to her third child. Her Indigenous midwife wasn't on shift and the attending midwife dismissed her pain. Less than an hour later, Alicia gave birth in the hospital bathroom. The panic button was pushed, she says. 5 strangers ran in. They just caught my son before he hit the ground. She, the midwife, just stood on the doorway staring at me. While Alicia had a safe home, not every new mother does. Those experiencing domestic violence and stable housing or substance use are often placed on long waiting lists with a lack of comprehensive support. Jacinta Krakoa, a Meneng Noonong academic at the University of South Australia, is researching how best to prevent babies from being removed amid concerns raised by Aboriginal midwives. Her work focuses on unborn child notifications, sometimes called birth alerts, triggered when health professionals identify issues such as homelessness, domestic violence, or substance use during pregnancy. And I've experienced clients who have had those health alerts simply because they may have had an issue with child protection before, because they were in foster care, and in this particular instance, because they are Indigenous. It is horrible to think that we allow this situation to exist. And there is an opportunity for you and I and for the Child Protection Party to confront these issues, to challenge these issues, and for you to notify us here at the Child Protection Party about any instances that you come across which are similar to the case I've just mentioned. Because we need to work together. And it's through this channel, the Child Protection Party channel, that you can make a difference. You can comment below. You can share this video. You can let people know that there is an organisation that is designed to help you. That is the Child Protection Party. Support us. Become a member of the Child Protection Party, and just remember that to do so, you just need to contact Child Protection childprotection.party is the webpage. Just contact us there and we could allot someone to help you. Let us know what you think. Comment below. It will be great. In the meantime, take care, look after yourselves, and more importantly, be safe. And remember, this is what the Child Protection Party is all about. Children's lives are important, and we at the Child Protection Party want the best outcome for all children.